Hello and welcome to Rawbellion Conversations, the ProDog Raw podcast, where we help you take a more natural approach to your dog's health and happiness. In this episode, we'll be discussing a crucial aspect of your dog's overall well-being, and that is Titre testing. So what is it? Why is it beneficial? And where would you go and get? So I'm your host, Caroline Spencer, canine behaviourist with ProDog Raw, and I'm thrilled today to have a very special guest with us, Dr. Vicky Simon, who is a renowned homeopathic vet down in the West Country, and she's extensive experience in the natural and integrative approach to pet health. So, Vicky, welcome, and thank you again so much for joining me today. Before we get into Titre testing, could you just tell us a little bit about your journey into homeopathy?
First, I would say I'm not just a homeopathic vet. I also do herbal medicine, acupuncture, and natural feeding advice. How did I get here? I actually went to vet school with an interest in alternative medicine, but I wanted to make sure that if I was advising people on natural medicine, I was coming from a background of conventional medicine so that my views held more weight. I grew up near Glastonbury, so there's lots of alternative communities around there that have lots of interest in natural medicine. So that's where the interest initially came from. Plus, my family, we always had a natural lifestyle, long walks, foraging food, blackberries and stuff like that from nature, and growing lots of our own food and having that kind of general view on health and integrating with nature. So I think that all definitely guided it too. So then I went through vet school, graduated, and immediately started a veterinary herbal medicine course. And whilst I was doing that, I started my first job, which was at an integrative vet practice up in Yorkshire. So my boss was a human and animal homeopath. I brought herbs to the practice for the first time and started studying acupuncture alongside obviously learning homeopathy from my boss at that time. Got a second job, and there I did the full homeopathic training. It was another integrative practice. Both of these practices were raw feeding recommending practices, selling raw food in freezers in the waiting room. That led me to do more research into raw feeding. As a student, I'd already seen practice with Nick Thompson, who is big in the raw feeding world and set up the Raw Feeding Vet Society. He'd already given me recommendations of books to read, places to look for good information on natural feeding. So that's how I got into that side of things. And after I finished my homeopathy course, I grew up in Somerset, so I'd always wanted to come back to the West Country to work again. I ended up taking over the clinic of one of my vet homeopathy teachers, a great guy called Jeff Johnson, who was retiring from treating animals. It all worked rather perfectly that I took over his clinic. Everyone already knew where I was. That's where I am now.
Oh, that's fabulous. And it's lovely to hear that your journey started way back in childhood, knowing that's you want to take the natural approach. Your parents took a natural approach to diet and health and well-being, and you've carried that through doing what you're doing now. How marvelous to have taken over from such a wonderful man as Jeff Johnson. He's an absolute delight. Getting on to Titre testing, Vicky.
Titre testing is basically the blood test. You're measuring the antibody levels that are already present in the blood to the three main diseases that we vaccinated dogs for. So that's distemper, hepatitis, and parvovirus. We're basically measuring the antibody levels, and if they have adequate antibody levels, they should be protected from that disease and not need a booster vaccination. The idea of the booster is to top up their protection. But if it's already present, you don't need it.
Sometimes a test for one of these diseases can come back as negative, but your dog can still hold the ability to fight that disease. It just means the dog hasn't been tested by that disease when they've been out on walks and met other dogs. How can we be sure that our dog is still covered, even though one may come back as negative and the other two positive?
So it very much depends, the negative results and how you interpret them, on the age of the dog and their previous vaccination history. For example, I often do Titre testing on dogs before their 1-year booster because the owners want to see if the puppy vaccines worked and if they need the 1-year booster, or whether we can count the puppy vaccines as being year one of the 3 years until retesting or revaccinating. If at that 1-year-old Titre test, I get a negative result, which sometimes I do, that usually means the vaccine didn't work as a puppy and they never developed immunity. Chances are that's a true negative. So they aren't protected. They've not encountered that disease. They've not mounted any kind of immune response against it. They're not protected. If I had a 12-year-old dog and I Titre tested it as a 9-year-old dog and it had a positive result, even a low positive or a high positive, as long as it was a positive, and you're then retesting and getting a negative. Now we know that dog has encountered this disease. It's had antibody levels. They've just dropped off. And what the body does is, if it's not encountered a disease for a while, it goes, this obviously isn't something that I need to be actively trying to fight all the time. So it lets the antibody levels drop off. But you still have this other part of the immune system. You've got part of the immune system that's in charge of antibodies and another part that contains memory cells. The memory cells will remember that disease. Even if the antibodies have all dropped off, the memory cell's still there. If they encounter that disease again, the memory cell goes, oh, hang on, I remember about this. Let's start producing those antibodies levels again. And then the antibody levels boost up and we've got lots of antibodies again. In the case of the 12-year-old dog, it may be that those antibody levels have dropped off, but they've still got the memory cells that remember. So if they were to encounter the disease again, they'd be protected because the body can start off that antibody production all over again. You can't measure memory cells, so you can't ever prove, unless you let them encounter the disease and see what happens, which isn't a safe way of proving it. You can't prove that they would be protected, but you can assume, if you really don't want to be vaccinating your dog, which a lot of people with much older dogs don't want to, they will probably be protected.
Yeah. Okay. Now, it's interesting you say every 3 years to have a Titre test, and also the British Veterinary Association says every 3 years to have a vaccine. But a lot of vets out there and a lot of councils are saying every year. Do you have to test your dog or vaccinate so regularly if you're
So
not taking to kennels or stuff like that?
So if you're not taking to kennels, it's always going to be different because it depends on the kennel's requirement. A lot of kennels will adopt the rather be safe than sorry approach and ask for a yearly either vaccination or Titre test. But if your dog isn't going to kennels, it's up to you to make that decision. Some vets recommend yearly just to be safe. With vaccinations, it's different to Titre test because the distemper hepatitis parvo vaccine is given every 3 years, but the lepto vaccine has to be given every year. So that's the one that they would be having on a yearly basis. However, I have seen dog histories where they have been having the distemper hepatitis and parvo every year, or at least they've had it 2 years in a row. I don't think it's always thoroughly checked which vaccine is needed for a dog by everybody.
Yeah. So you mentioned leptospirosis there. Can you test for that?
You could, but it's mostly a pointless affair because lepto has very short-lasting antibodies. In many dogs, within 6 months of a lepto vaccine, the antibody levels will have dropped off. So it could look like your dog needed revaccinating only 6 months when the vaccine actually lasts for a year. Testing them every year, the majority of the time, you would just be having a negative result. So we
Right.
don't Titre test for lepto. The other thing that's tricky with lepto compared to the others is that there are loads of different strains of lepto. So the Titre levels could be confusing because you would be checking that to check for the disease. And so the vaccine can show up as well. But yeah, we don't Titre test for lepto. Lepto, I tend to discuss the pros and cons of vaccinating and not vaccinating. We discuss in detail the disease, possible vaccine reactions, everything about it. And I allow owners to make their own informed decisions based on their dog, their lifestyle, and all the other things that we discuss during our appointment.
Yeah. Oh, that's lovely. Because you were talking about with the distemper parvo, the other one, that is held,
Like,
if it shows up as a negative, it's held in the memory cells. Now, is lepto not held in that memory?
yeah, absolutely. If your dog has been vaccinated for lepto, then it will have memory cells for lepto. But it's the unprovable. And that's for
Yeah.
most people is they want something that they can prove that their dog is going to be protected or not. And
Yeah.
that's what you can't do with a negative Titre test, so you can't prove that they would be okay.
Yeah. Okay. And of course, there are so many different strains in different areas as well in the UK. So we should teeter test every year. You take into kennels, and that's what they require. Are there many kennels in the UK that will accept teeter test over vaccine? How do they work? Do you know?
I know there are kennels that do it because I have clients that go to kennels that will accept Titre testing. I think it's very much down to the kennel owners. For their insurance requirements, it needs a proof of vaccination, a yearly vaccination, but some people consider a Titre test to be a proof of protection, and so they will accept it. It requires ringing round different kennels.
Yeah.
I think it would be amazing if someone could compile some kind of website with a list of all the kennels that will accept Titre testing, because the holistic pet owner world would be very grateful. I'm often being asked by people, but I have clients come from so far around me, it's hard to keep track of all the places that will accept that or not.
What if your vet doesn't offer teeter testing? Do you have to be referred to somebody like you, or can people just get on your list and say, "Hey, Vicky, can I just bring my dog along?" Do they have to ask their vet first?
And I don't require a referral for people to come to my teeth testing clinics. I always make sure when I do my teeth test in the clinic, I have very short slots for people. We are literally just doing a teeth test and then off you go. I'm effectively running a mini lab service where I'm just taking the blood, running the test, giving you the result, and advice based solely on the result, not to do with the rest of your pet's health. I occasionally have people come to me outside of a testing clinic or existing clients that want to do a teeth test. We book an appointment and I get the history and all of that as if we're having a normal appointment. And then we might do a teeth test as well. But I always prefer to do the clinic because I work on my own completely the rest of the time. During my teeth testing clinics, I have an amazing vet nurse who helps me hold dogs and raise veins, and it makes it much easier when you've got an extra experienced pair of hands to take bloods than just you and the owner and sometimes a very wriggly dog.
Yeah, absolutely. In the process of teeter testing, do you have to shave their legs or what?
I personally don't shave legs. The first clinic I worked in had loads of show owners bringing their dogs in, and the show world are very anti leg clipping because it can take a while to grow back. I learned my bread and butter of blood taking, not clipping, so I don't. Very occasionally, I might thin the fur with a pair of scissors just to make the vein more visible, but I never use clippers. I find it can make the dogs more anxious. It's extending the procedure. It involves more handling. Whereas if you can get blood quickly from a vein, the whole thing can be over in 5 minutes. And the dog gets loads of treats and they're happy.
Yeah, absolutely. And I gather you do your teeter testing in a nice, gentle, quiet, calm environment. You say that dogs come in chilled, whereas in a conventional vet, with all the smells and chemicals, they can be rather more anxious, and you've got your amazing nurse. Likewise, if an owner of dog says, actually, I would prefer to hold my dog because he's going to be better with me there, are they able to do that?
Absolutely. I tailor everything to the dogs and the owners. In my normal practice, I treat a lot of behavior cases. So I understand how important it is for people to follow whatever protocol they have worked on with their dog. If the owner says, I need my dog to be muzzled or not muzzled, then we will try to follow that. If the owner says, actually, my dog's really bad if I'm in the room with them, I want to just leave him and wait outside until you've taken the blood and then I'll come back in, that's what we'll do. If the owner needs to hold the dog and the nurse just raises the vein for me, that's what we'll do. We always try and have loads of treat to make it an enjoyable experience. Most of my teeth testing clinic I do out of my practice. So my practice is basically just a small waiting room and a consulting room. And the consulting room, I always say it's disguised as an odd living room. So you go in, there's a rocking chair, an armchair. I sit on a big gym ball, got a big wardrobe full of herbal medicine, plants around the place. It smells of rather than disinfectant and cleaning.
Yeah.
There's not loads of other things going on in the practice at the same time. You're only going to cross over with the person before or after you. And there's not loads of other dogs and cats and stuff
Yeah.
waiting around, producing anxious pheromones.
So it's very much a more low-key affair for our dog, but also their caregiver, because it can be anxious taking your dog to have a procedure done, wondering how your dog is going to behave, your anxiety transfers over to the dog as well, doesn't it?
I book relatively long slots because if it all goes swimmingly, it should only take 5 minutes. If you've got a single dog, I book a 15-minute slot. And if you've got 2 dogs, 20 minutes, 3 dogs, half an hour or less, if I know your dogs and I know they're easy to do, we probably would spend the first 10 minutes of that where me and the nurse would be sat on the floor, chatting with the owners, trying to offer treats to the dog, making it a bit more comfortable in the scenario. And then we would get around to handling and taking the blood and things like that. But equally, I have other owners that say, actually, can we just do it as quickly as possible? I want to come in, we'll take the blood, we'll leave. And that's
Yeah.
also fine. We just work with whatever's best for each individual animal. But I'm hugely into animals enjoying their visit to me.
Yeah, absolutely. And it's lovely to hear that the dog is floor-based, because that's
Always
the anxiety for many dogs is being lifted up above their own head height. It's not natural and it doesn't feel good for them. So that's lovely to hear. Now,
I don't even have a table in my clinic to put dogs on.
ideal.
So
We love your. Yeah, another thing, getting results back. When I get results back, especially when we worm cats, stuff like that, I can't make head nor tail about it's positive, it's negative, it's an in-betweener, and what I should do with any of that. How do you educate the owner so they understand actually what they've just got in front of?
So there's different ways that you can get teacher testing results. I use an in-house testing kit, and anyone who's using an in-house testing kit will give you a result that is 0 to 6 on a scale. 2 to 6 is positive, 1 is borderline, and 0 is negative. If you get a test done at your conventional vet and they send it off to a generic vet lab, then that tends to be much more expensive, but you get a more specific result. It could be like 56 or 172. There's a much bigger scale. So you could argue that you're getting a much more specific result, whereas the in-house tests are a little more basic. But the idea is you're looking to see if it's positive or negative for each of the diseases. I run the tests usually either the same day or the following day that I'm taking the bloods. And then within the following week, I will have emailed everyone with all of their results and interpretations. So you will get, I list each of the diseases with the number next to them and underneath explain what the scale means in terms of positive or negative. Below that will be a brief explanation of what they need to do. If it's all positive, it will just say all positive, retest 3 years. If there's one that's, say, a bit borderline and I'm not too sure about it, I might say recommend retest 1 year. And then if there's a negative one, I will usually offer options. Revaccinate your dog. Option 2, don't do anything. Option 3, retest next year, or whatever the options might be. And they will vary depending on the dog, what the owner's already told me about their vaccine preferences, the dog's previous experiences, lots of different things. So I give them a basic breakdown of exactly what it means. And if they want to discuss that further, then we can book an extra phone consult where we can go through in more detail what the options are for them and their dog.
Yeah. Okay, so they would go back to their conventional vet to have a vaccine if that's what they choose. Now, what if only one of the diseases comes back as negative? Do they do individual vaccinations?
Unfortunately, the only one that's available as a single vaccine is parvo. The distemper and the hepatitis are only available as part of the trio together. So if you get a negative parvo, you can get a single vaccine. Otherwise, you have to go for the full booster. The parvo isn't available everywhere. Lots of vet practices don't stock the parvo on its own. You might have to ring around and ask locally to see if you can find anywhere close to you that does the parvo on its own.
Oh, that's really interesting. Vicky, there's so much information you've given us that's absolutely fabulous. Hopefully it's put a lot of people in a better place to decide which way to go. Now, is there anything that I've missed that you think's important to pass over to people? That's one thing I was thinking about, kennel cough, because dogs get the kennel cough drops. Is there anything to do with taking a test for that? And what sort of infection is it? Virus, bacteria?
The kennel cough is basically what we call kennel cough in dog, is a bit like what we call a cold in people. A cold could be an influenza virus, it could be a rotavirus, it could be a coronavirus, dare I say it. And kennel cough is a bit the same. It's a whole complex of different viruses plus a bacteria, and any of these alone or in combination can cause kennel cough. But kennel cough, like a cold, tends to be a low grade, self limiting type disease. So, usually within 2 weeks, the dog will be completely back to normal. And most dogs only have a few days of coughing and then maybe the odd cough after that. But it's only really young or old dogs that can get ill, or the odd dog that might be immunocompromised and might get a secondary infection or something like that, where kennel cough's really problematic. So I tend to only advise people vaccinate for kennel cough if it's required by a kennels or a trainer or whoever. And otherwise, to consider it like a cold. We don't even
Yeah.
vaccinate ourselves for a cold, maybe for flu,
Yeah.
but uh,
No, exactly. Because I had at one point, I had about 8 dogs and they all got kennel cough. But there was only my old boy who was 14 who needed to go on to antibiotics because it ended up as a chest infection. Everybody else just got over it as I didn't have kennel cough, a cold. uh,
dogs can still get kennel cough if they've been kennel cough vaccinated, because you only ever vaccinate dogs for the bacterial part, the Bordetella bacteria, and for canine parainfluenza. But there are a whole load of other viruses that can cause kennel cough that you're not even vaccinating for. So you're not 100% preventing your dog from getting kennel cough, even by vaccinating them for kennel cough.
and is it true to say that if our dog has been vaccinated for kennel cough, because it drops in the nose, that it actually drops that vaccine as it goes on its walks for a week to 10 days, and someone else who's not been vaccinated can go and snoof there and end up with kennel cough?
And even some dogs, after they've had the kennel cough vaccine, can express kennel cough symptoms because it's a live vaccine.
Yeah. Very interesting. Thank you for that.
Mm. So I normally
We,
tell
we,
people
we've,
about testing.
yeah, how much would you
Um,
expect to pay for a Titre test?
If you're going to somebody that is regularly doing Titre tests, then the chances are they're doing the in-house testing kits, and they usually are priced between 50 and 70 pounds, I would say. So at my practice, a Titre test is 55 pounds per dog. If, however, your practice is sending the results off to an external lab, then the chances are that's going to be significantly more expensive. So I know some people who've been quoted 150, 180, think ridiculous
Wow.
levels like that just for the test.
Yeah. Oh, it's a colossal difference, isn't it? To find someone like Vicky Simons. Yeah, you
And I
get
mean,
a fabulous.
I think the other people often want to know about TT testing. Like, the reasons why you should do it is really just all about avoiding over vaccination of pet. So each time you vaccinate your pet, there is a risk of a vaccine reaction. This could be an immediate one in the few days following the vaccine, or a delayed or longer term vaccine reaction. So there are various different immune mediated diseases. An immune mediated disease is where your immune system attacks part of your body. There have been various immune mediated diseases that have been linked with vaccination, where vaccination can act as a trigger for these diseases.
Right.
So this is things like immune mediated hemolytic anemia. So that's where your body attacks the red blood cells. There's also immune mediated thrombocytopenia, where your body attacks the platelets, so that help with clotting. And then there's various immune mediated skin diseases. But obviously, that's worst case scenario. I also see some more low grade issues that through studying lots of dogs' medical histories, you can often see this little pattern where they've got something like a chronic skin disease. Each time they have the vaccination, you can see in the history that within the following month, they've maybe had a little flare up of their skin
Yeah.
disease, or each time they give the vaccine, the immune system has a little struggle and they get this little flare up of their existing disease. So that's really what you're trying to do, is avoid this overuse of vaccinations so that you can avoid the potential negative things that can happen post-vaccine.
Yeah, absolutely. That's really important, rather overloading the system. It's like with all these things we give our dogs, it's better to use when necessary. Vicky, this has been a fascinating discussion. Thank you so much for joining me. And I'm sure there are plenty of people watching this will gain so much insight into which way to go and understand testing better. When you're informed, you can make an informed decision.
I think that's the biggest thing that is often missing for a lot of owners in their vet consult, feeling like they're making informed decisions. A lot of people feel they get recommended a course of treatment by the vet and they don't have the information or options to make their own decisions. As a vet, that's what I'm trying to do. I'm not trying to make decisions for you. I am giving you information and allowing you to make those decisions for yourself.
Yeah.
And I think that's really important.
Hugely important. Oh, that's fabulous, Vicky. It's been such a pleasure having you aboard today. I hope we have many conversations in the future. I'll always remember to press record because this is the second time we've done it today. Absolute pleasure. Thank you so much. You're an absolute treat to speak with. And yeah, just flows. It's lovely. Thank you.
No worries. It's been lovely.